Good morning, good afternoon. Welcome everyone, and thank you for joining us for the official closing of the 2022 CanWaCH Academy. I'm joining you today, this is why I said good morning, from the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh, also known on settler maps as Vancouver. I'm normally located in the traditional territories of the Mississauga and Anishinaabe, and I've had the great privilege of working and studying and learning from many of the elders in the area. And I hope that our entire CanWaCH Academy, as well as the words that I'll share today, do honor to the people who have taught me and who have guarded and been the guardians of the land since the beginning of time. I also would like to acknowledge that today is May the 5th, the National Day of Awareness for Missing and Murdered Indigenous Women and Girls. Today, we seek to keep the memories of those lost alive, with voices of survivors and families at the forefront. Awareness, remembrance, and action are important, and perhaps those should go in the opposite order, with action being our primary concern as we move forward to try to bring justice to the incredible injustice that's been laid at the feet of Indigenous people, and particularly of Indigenous women and girls. Throughout the past week, it has been our great pleasure as the Secretariat of the Canadian Partnership for Women and Children's Health to host you, the members, our partners and friends online for 4 days of virtual learning, workshops, trainings, tutorials, and knowledge sharing. It's been a couple of years that have been really difficult for the sector, and we really wanted to focus in this year's flagship events on recovery, renewal, resilience, and really do what we do best, which is hopefully bringing the knowledge within the sector to the table to share and to learn, because we really believe that we know what to do, our members know what to do, but it's about getting those messages out and across and to one another. We're just so impressed with the level of participation in the Academy. I think, we know that there's a tiredness with virtual participation, and so we really wanted to focus these sessions, these 16 hours of learning, over 1,000 participants and 24 different speakers on tangible and practical skills that you could walk away with. Everything from CP style and learning about punctuation to the nitty gritty on monitoring and evaluation and our metrics in the time of moving to more virtual. So I hope that you took something away from the sessions, and I really encourage you to fill in the feedback, because I think this is going to be the way that we work going forward. A huge thank you. You see this list in front of you of all the speakers who we have engaged with. And we just really appreciate that they were willing to show up and bring their knowledge to the table. We're very fortunate, I think, to have a sector, like I said before, full of knowledge, full of awareness, and really, really keenly interested in sharing that out. I'd also like to thank, and they get to interpret me thanking them, the interpreters, Olivier, and his whole team from American Interpretation. It's not easy sometimes the level of excitement means that people are speaking quickly and all this kind of thing. And they've been with us from the beginning, and just so grateful. And a huge thanks to Geneviève Riviard, who's done translation for all of the presentations that you saw this week. She's sort of an extra member of our team, and her talent and speed just continues to amaze us. And we're just really grateful that we were able to get so much of the content in both official languages. We also had speakers who met in person with us, and you see them on this list here for the cross country connects that we did this week in Montreal, Toronto, and tonight we'll be in Vancouver. These in-person moments were designed to be small and intimate, and to not be in Ottawa for once, which we do many of our events in Ottawa, and we really wanted to connect in with member organizations from outside of the Ottawa area. Although Ottawa, we are coming to you, and more of that at the end of the session. But we had about 100 members engaged in person. And I have to say, from attending the first two, it was a really wonderful thing to be able to break bread together and connect in that way. And I hope that we will be doing more of that going forward. We wanted to use this opportunity, this moment with us gathered and on kind of the tail end of the learning and connection that we've done, to announce a new project being launched, or a continuation of a project being launched, called the Collaboratives. So this is the second time that CanWaCH has engaged this concept of how can we bring together the knowledge in the NGO sector with knowledge of research institutions and researchers to really advance our sector around key data gaps. We know that data drives decisions, but that's only the case if we have that data and if we have the knowledge we need to make smart choices and informed decisions. And that's why we've established the collaboratives. So the collaborative, the actual process is rooted in a feminist approach and really trying to create, I think, forward momentum towards the SDGs. So the objectives are to investigate, incubate, and inspire. And I have no doubt with the 3 projects that I'm about to discuss a little bit with a couple words that they will do all 3 of these things. So the first is a project by the University of Ottawa, the National Abortion Federation of Canada, IWAG, the Adolescent Health Productive Health Zone, the Hakora Peace Foundation, and the University of Kanasha and Vatala Global. This project is being delivered in the DRC, Jordan, Pakistan, Thailand, and Venezuela. The initiative will establish recommendations regarding the collection of rigorous, high-quality information about self-managed abortion in fragile and humanitarian settings, and will work with stakeholders to develop tools to facilitate the uptake of these recommendations. So both the development of recommendations and then the work to really encourage and connect to the stakeholders who will make decisions. The initiative consists of 3 phases. The first is conducting rapid assessments in the 5 countries that I mentioned, developing recommendations and tools to support uptake and build a stakeholder capacity, and then disseminating the findings with local and global audiences. And a shout out to all the organizations involved in this particular project at this particular moment in time, when we are seeing across the globe, but certainly with our neighbors to the south, a major challenge to the rights of women to choose. And I think it's a moment when we all need to, much like we did during the pandemic with our frontline healthcare workers, and I hope we continue to do, but really hold up the people who are working at the front lines of abortion rights, because they're being challenged, and they're being challenged in new ways. And at the most, that's incredibly draining for folks working in this field. And at the worst, it's quite threatening, in fact. So big shout out to that project. And I'm so pleased that CanWaCH, along with Government of Canada, is able to invest in projects like these, and in this one in particular, with our good friends in those organizations. We asked project partners to tell us why they think the project is important, and this is what they shared. And I'm quoting, "We're delighted to build on our previous collaborative to explore how to capture information about self-managed abortion in fragile and humanitarian settings. And we look forward to collaborating with both local partners in the 5 countries and global partners to showcase and support innovative best practices." Our next collaborative is going to be presented by the University of Toronto, Nutrition International, and the Briere Research Institute. This project focuses on Kenya, Nigeria, Pakistan, the Philippines, and Ethiopia. The project will define a robust action plan to inform the development of a toolkit for to operationalize gender transformative framework for nutrition. GFTN. It will research potential outcomes to measure activities, indicators, sources, and target groups that would inform the design, administration, and monitoring evaluation according to this framework. By addressing these underlying barriers to effective data collection and use, the outputs of this project will be utilized directly by communities and folks in the nutrition sector to drive gender transformative change across the nutrition program that tackles gender inequalities, discriminatory gender norms, and unequal power imbalances that contribute to malnutrition. We all know that women eat last and least when it comes to when there's scarcity. And I think this framework is going to really start to help us both understand why and drive solutions when it comes to the nutrition program that so many of our partners engage in. So when we talked to the folks at U of T and NI and the Briere Institute, they said, our collab seeks to build on the momentum created by Gender Transformative Framework for Nutrition to transform the way organizations tackle the underlying drivers of malnutrition through the co-creation of practical tools and guidance that promote gender equality and empowerment through multi-sectoral action. And again, this is a moment in nutrition in which we know the hunger crisis is both here and will grow in the weeks, months, and years to come. And I really hope that Canada, alongside these partners, can lead in thinking about the implications of gender inequality and how that impacts nutrition for people around the world. So I'm really excited to see what this project uncovers, rather, I should say. And our third and final project is by the University of Calgary, the Canadian Association for Global Health, Mabera University of Science and Technology, and Common Language DST. The project will take place in Canada and Uganda. The Digital Storytelling Lab will address important barriers which limit data quality and research dissemination using a participatory method of feminist public health research. This lab will undertake a rigorous literature review and scoping study and will incubate the DST approach through a needs assessment survey and follow-up discussions to assess adaptations for scale up and scale out. The project involves preparing an evidence-based, practice-informed, health-focused DST package consisting of guidelines, recommendations, and innovations, which can be adapted into tools and training material for sharing with others in Canada and beyond. When we asked these project partners to tell us what they thought would be the value of this project, they said digital storytelling creates a space for the storyteller to share a compelling and a meaningful account of their experience, facilitating reflection, action, and change with the goal of improving health outcomes. And again, I think this was selected with this moment in mind in which misinformation, incorrect information is at an all-time high. And how can we get the stories out there that we want to be heard, not just voices who are in some spaces dominating, to really positively impact health outcomes, both in Canada and around the world. And I'm really excited to see where this project takes us. So a huge congratulations to all three of these collaborative projects. We are really pumped about working with them and through them to make an impact in the sector through these connections with researchers, NGOs, and in some cases, the private sector, universities here, universities in the global south. It's really the bread and butter of how CanWaCH wants to operate in partnership. For more information about the collaborative or the process, please feel free to reach out to info@canwatch.ca. And as we wrap up this incredible week, I do want to thank Government of Canada and our partners at Global Affairs in the partnership branch, who have really worked with us on this program to try to get important information out to you, the partners. And we really appreciate their support and openness to coming alongside us with this journey of learning, and in the collaboratives as well. Actually, they're the funder behind that project. So big shout out and thanks to our team, Jean-Michel, Geneviève, and Jean-Bernard. And as we wrap up this week, let's talk about what's next. We are coming to Ottawa for the Equal Futures 2022, a gender equality summit that is being held in person in Ottawa from June 7th to 8th. Through the theme Collaboration, Collective Action, and Community, the summit will provide an in-person forum for the gender equality movement to come together, build connections, strengthen capacity, share expertise, and establish the collective actions that will pave a path forward for advancing gender equality in Canada. And we really want to make this moment the realization of our vision to bring the SDGs to the hands of the Canadian domestic serving gender equality movement, as well as the international development serving gender equality movement, and really make those connections, because we believe that partnership across borders, within borders, innovative partnerships, new partnerships are the way to achieve the SDGs. And this summit is really our moment to express that through really interesting sessions, knowledge spotlights, and all kinds of things. And I really look forward to seeing all of you at that. Thanks once again for joining us this week, and please don't hesitate to reach out to us at info@canwatch.ca, or to me personally at janderson@canwatch.ca. I would love to hear from you and hear about your experiences at the summit and the CanWaCH Academy. Thanks so much. Bye, everyone.